St. Lucia on Thursday, June 1st, took the initial step in establishing universal health coverage, with maternal and childcare the first beneficiaries. The significance of the occasion was not lost on the attendees, comprising cabinet ministers, leading local dignitaries, and a cross-section of the St. Lucian public. The director of the Universal Health Coverage, Dr. Alicia Eugene Ford, says this is a notable accomplishment for St. Lucia.
Today is a very important day, as it marks yet another milestone achieved in our healthcare system. The government of St. Lucia, through the Ministry of Health, Wellness and Elderly Affairs, is launching universal health coverage, phase 1, and maternal and child health services falls within this phase. This is a great achievement.
Prime Minister Philip J. Pierre says as significant as the launch of universal health coverage is, it is only the first step in the reform of the health sector.
And I believe that this is just the beginning of the health revolution in this country. And I applaud the minister, I applaud the team at the Ministry of Health.
The Health Minister, Moses Jabatis, says the journey to get to this milestone was fraught with challenges. He was high in praise of the support from his cabinet colleagues and the team from the Ministry of Health and Wellness.
They realize that there's no country on earth up to today that has achieved perfect universal health coverage, that every country is still struggling to improve their services and to fine-tune their services. So I said, you know something? I met with them and I said, you know what? We are going to start the implementation of universal health care. Guide me. I went to cabinet and said, what are we going to do? We are not waiting for all of the information on financing. We are not waiting for all of the experts to tell us exactly what to do, because if we do that, it's going to be election time and we will not have delivered anything on the universal health coverage. So we said we are moving step by step, phase by phase, delivering to the people, and as we move along, improve the healthcare services, improve the quality of infrastructure, improve efficiency so that we can implement universal health coverage as we move along. And that is exactly what we are doing.
Prime Minister Pierre says his conversations with mothers in his constituency highlighted the need for the provision of expanded services to new and expectant mothers and their babies.
I've spoken to several mothers in my constituency who said to me they cannot afford the basic tests when they are pregnant so that to ensure that they are healthy and their baby is healthy. They cannot afford it. Now, if you can't afford it, you will not mind, you will not care with those who cannot afford it. But we care about those who cannot afford it. And this is why we are doing it here today, to ensure that those who cannot afford it, they get the opportunity to get the basics, the prenatal care that they need so they can have healthy babies. So what's happening here this morning is a significant step.
The first phase of universal health coverage, which targets mothers and their babies, means the range of services that will be available to them free of charge will be broadened to include laboratory and ultrasound services. Stanley Lucian for the HS News Force.